So what causes gum recession? Gum recession is when the gums around the teeth start to move downwards or upwards, if we're talking about the upper jaw, where more of your tooth becomes exposed over time. Now, in terms of what causes gum recession, there can be many causes. The most common cause is grinding. When you grind your teeth at night or during the day, or if you're a heavy clencher, essentially you're putting a lot of force on the teeth. And if you imagine taking a stick between your two hands and bending the stick, what happens in the middle of the stick is that part will break off. And that's essentially what happens with your tooth. As it's flexing while you're biting, your gums around the tooth start to move down away from that area of torsion, and also causes those necks of your teeth also to break, like that stick would have broken. That is the most common reason why you would have recession. It is also possible that if you are someone that aggressively brushes your teeth and you're not brushing the tooth itself and you're focusing more on the gums, that you can cause some minor damage to the gums. But that's not necessarily something that we see very often. Certain diseases, certain conditions, things like that affect your ability of your wounds in your body to heal very quickly can also rapidly progress gum recession. In terms of what we can do about it, the very first thing we need to do is find out what is causing it. If we can identify the cause and remove the cause, then we can start to talk about how can we get the gums back. In cases where the recession is not severe, normally they can actually grow back themselves to a certain extent. If the gum recession is moderate to severe, then we may be looking at doing some type of gum graft, where we take gum from another part of your mouth, and we essentially stitch it onto that area where you've lost it, and in the hopes that that gum will grow onto that spot and give you back that position again.
Your dentist, your choice.